facilitator here because I am maybe the least knowledgeable person on the free clinics. So I will facilitate the discussion. The objective here is to gather the people who are actually involved in free clinics and other low cost or free healthcare and even the insurance part of it is engaged, so that each other we all learn from each other, and also if there is a consensus here to develop a group where networking group to start exchanging information beyond today, so that we continue to discuss it, and inshallah we will develop a platform where all the free clinics and other health related issues for those who are needy and underserved, we become the platform or the knowledge base, so that each other can contribute and share. That is the objective of this meeting. So with that, Dr. Sufi, from my right hand, if you could.
Assalamu alaikum. Ashraf Sufi, I'm past president of IMANA, and as I was saying, Dr. Sheikh Hassan, he is also past president, and I followed him. And we are working in the same clinic, which is called MCC Clinic in Maryland. I will be very brief. I give my time about one Friday a month. I used to give 2 Fridays a month, but I'm a subspecialist, I'm a gastroenterologist. So they thought that subspecialists are not as much needed as the family doctors are. The concept of MCC clinic was started by a cardiologist who turned to be a primary care physician, and then he started it, and then after that, because he was really not able to really facilitate it or make it bigger, the masjid got involved. Our center, which is called MCC Center, they rented him a space there, and then we started looking for volunteer physicians. By the way, first of all, I just want to say, concept of free clinic is almost gone. It's a low income clinic, or so because we do charge the patient. So I think if you're thinking about completely free, that's not a concept in MCC. So then he became the director, Dr. Qadri, his name is, and he became the director. And then we have the volunteer physician. Initially we were able to get volunteer physicians, but when I moved to that place, it was about 4 years ago, it was really very difficult to get volunteer physicians. I was a gastroenterologist, and out of 100% of the physicians, there are about 85% of them are paid physicians, including the director. I will just go very briefly about the revenue. The revenues are produced by, the major source of revenue is the Montgomery County, which is our county. Any low income patient with a criteria about how much poverty level they have, they can come and see. And for each patient, the Montgomery County pays us some limited amount, I think $68 or $70, something like that. And also patient pays $15. If it is a patient coming from 15. If a patient is coming from Virginia side, not from Montgomery County, or is a visitor like any foreigner, or like my relatives come from Pakistan, and they pay $35. And then the other source of income is the lab. So if we do the lab charges some money which patient has to pay. We refer out our x-rays, our other services to outside. And then the other source of income is we have grants. We apply for grants, like we have grant from NIH, we have grant from that the breast cancer screening, Coleman, and also from where I was working, Kaiser Permanente. It's not, Kaiser Permanente is not giving us money, but they are giving us the nursing help. The middle, nurse practitioners, and they provide us. So off and on, we are struggling so we don't refuse any patient. That is the source of income. Expenditure, as I said, all about 85% of the physicians or the staff, the whole paramedical staff is all paid. And the physicians, about 85% of them are paid, 15% are volunteers.
Salary based?
Salary paid,
The
yes.
physicians are salaried?
I'm sorry?
The physicians are salaried?
Yes, but it's not, you are not thinking about just like we earn in private practice. It's just like, for example, the physicians are paid by $85 an hour or $80 an hour, and the other people who are volunteer, they don't get paid.
How do you recoup this cost?
I'm sorry?
How do you recoup this cost? $80 an hour?
Well,
You missed it
I went over the revenue, you probably
We will go one whole round,
Yeah.
so then we come back to any
So,
specific.
so that's basically it now, but I think the only thing, we provide almost all the services. Anybody who cannot really, for example, need surgery or something, we send it to Catholic Charity, we send it to other places where they can get it, free care and all kind of thing. So we never refuse a patient. Some patients who cannot really pay, the masjid have zakat fund, and the masjid then pays out of their zakat fund sometime if they are eligible for zakat, or if they determine their income and or poverty level, and if they think that they can get the zakat, then they give that zakat fund. The masjid also, one of the other thing is the masjid where they have provided the building rent is right in the masjid itself, and we don't get, they don't rent us, they don't ask for us rent. So that's a big source that we cannot really, it's a good thing that they are doing it. There has been some new changes, which is really, I'm in the strategic committee on that, and we are discussing about it, because with the Omaba healthcare, there are a lot of changes coming. First of all, the Montgomery County has said that because you are going to start getting Obamacare patient through Medicaid and all that, we are going to decrease your, either decrease that $68 which we pay you, either by 2015 we are going to completely eliminate or decrease it, because, and they are encouraging us to start taking Medicaid patient or Medicare patient. So as a strategic committee, which has not been approved yet, is completely new, we have decided that we should go ahead and just like charge the patient or charge their insurances and just treat it as a private clinic, but with 5013 exemption and all kind of thing. So that may impact us quite a bit. I think most of the feeling is that it may impact us adversely, but some of the clinic which we have, because there are about 9 or 10 clinic in the Maryland area where I live, they are also charity clinic, some Catholic charities, some Spanish charities and all that. They also think that we should go ahead and start taking the private insurance, and those people who cannot afford the insurance, or they are visitors or they are from somewhere else, we should continue provide them the care like what we are doing, maybe increase their $35 to maybe $40 or something like that, and all kind of thing. So that's where the revenue and the expenses come. So we don't refuse anybody at this time.
Can I just finish up with the
Yeah,
MCC
yeah,
clinic,
yeah.
so that we don't have to come back here? Just to add a couple of things to what Dr. Sufi said. This clinic started out as completely free volunteer clinic, and we've since migrated over to almost fully paid staff clinic, with the exception of just a few physicians. The other point I want to make is that we provide care to patients regardless of their race, their religious affiliations, or their legal status in the United States. We don't ask any of those questions at all. We are on the verge of establishing a dental clinic.
Yeah.
And the final thing I want to add is that the governance, you really have to have a good governance of the clinic. And we have a medical clinic board and the subcommittees from that. And in addition to that, there is a medical executive committee which actually oversees the appointment of physicians to ensure that they are indeed qualified to provide care in the state of Maryland. But he provided an excellent overview of it. The one thing that I would caution people who are thinking about this, or who already have this, is that you can get into trouble if you try to bite off more than what you can chew. Okay?
I have a question about liability issues with a religious organization. Is this an independent organization?
Our clinic,
Yeah,
it is associated, like the MCC Masjid Board overlooks everything. I mean, we are, whatever the medical executive board make a decision, it has to be approved by the Masjid Board. So Masjid Board is definitely involved.
So
As
it
far
is-
as the eligibility is concerned for medical malpractice, I think yes, we provide the medical liability, but most of the physicians,
have
like
their own.
myself, I have my own.
Yeah. But if you're doing it on your own, you need to inform your liability carrier
Yeah.
that
Because
you're doing
I
that.
feel organization is a part of religious organization. It is a not. It has not yet been not for profit.
it is not for profit.
Medical. So.
And discussions are underway to separate it out from the masjid itself.
Well, we came to know through the strategic committee meeting and exploring those ideas that even though, you can accept the insurances and all that, because my fear was, because I'm in medical practice and, I'm for profit myself. So how come if the clinic start taking the payment from the insurance and all that, whether it will be, whether it will lose its status of non-profit? And we have been assured that it will not. So I think that's where it will stay the same way.
The one last comment I'll make, and then I'll stop, is that if you're going to be getting into electronic health records, you got to be very careful, because one of the things this has done to us is that it has slowed down the progress. Maybe it's a learning phase, I don't know, but there is an issue with that right now, so that the number of patients that are being seen in any one day is reduced because the physicians can't work fast enough to keep
Well,
up.
that's a temporary measure.
Yeah, it might be just
I think
temporary,
everybody will get used to
Yeah.
because one of the criteria by the Medicaid and those people, before they will give, two the criterias are there, that the health, coverage has to be for 24 hours. That is one criteria. The other one is the electronic medical record. So if you don't have electronic medical record, then Medicaid will not pay for that.
And also, how many days a week this clinic runs?
It is running except Saturday. It is running all the day except Saturday.
No evening coverage.
No evening, but we
Sunday.
are thinking about it. If we are going to make it
On,
a,
on Sundays, we probably see more patients than we do during the week.
yeah.